So what do you think? Daryl, why don't we begin, please?
Okay, that sounds great. First, my name is Daryl O'Sullivan, and I'm the Vice President and Treasurer of the Western Neuropathy Association. And it's my pleasure to coordinate and sort of MC the monthly webinars. So today's webinar is titled Explaining Peripheral Neuropathy for Family, Friends, and Caregivers. In this presentation, you will gain a better understanding of this disease that affects the peripheral nerves, including a little science lesson on nerve fibers, the difference between large and small nerve fibers, causes of peripheral neuropathy, the difference between the peripheral neuropathy and their symptoms and treatments. You'll also learn why about the stages of grief experienced after a medical diagnosis. The first section of the webinar will be presented by Catherine Stencil, one of our Western Neuropathy directors and the editor of the Western Neuropathy Association newsletter, Neuropathy Hope. Catherine is also the leader of the Second Saturday Peripheral Neuropathy Support Group and co-leads the other two group sessions each month. She also manages the Houston in-person support group that meets quarterly. The second section of the webinar will add in Catherine's husband, Jeffrey Doit, her peripheral neuropathy caregiver. They will discuss how he helps her manage her daily living with this disease. So please hold your questions to the end, and then we will start right away. Catherine, it's all yours.
Thank you. I think everybody should know by now from the way I've been talking, we are doing this in a little different format for our webinars. It looks more like what we have during our support group meetings and where you can see everybody. If you don't want to have your picture visible, you are more than welcome to go off and stop your video by clicking on that little button on the bottom left-hand corner. But for the first part of this, mostly we're not going to be seeing everybody else because I'll be having a PowerPoint presentation up. But on the second part, we will go back to this kind of format as we have a discussion with my husband about his caregiving efforts on my part. I also want to warn you that I'm really having trouble talking with these liners in my mouth. So I'm just telling you. Okay. All right. I'm going to share my screen. Okay. So as Daryl said, the title of this is Explaining Peripheral Neuropathy for Caregivers, Family, and Friends. So this is kind of an outline of the topics that I'm going to be doing. The first part is going to be kind of the path to peripheral neuropathy. I'm going to have kind of a science lesson at first where we're going to talk about neurons, axon, myelin sheath, how you get the disease in a very general fashion, and the types of nerves. Then we're going to list some of the causes. There are almost over 200 causes of peripheral neuropathy. I'm not going to list all those, but I think you will see that there are a lot of different causes of this disease. Then I'm going to talk about the types of peripheral neuropathy and some of the symptoms that you get with those. And then a little discussion on cures, treatments, management, and support. Then a little section about how peripheral neuropathy is an invisible disability. I'm going to talk about then the 5 stages of grief after a medical diagnosis, and then about emotional pain and support that someone who has peripheral neuropathy suffers through. Then for the second half, my husband will join us with his perspective as a caregiver. So peripheral neuropathy, and we should probably talk first about what the peripheral nerves are. So the peripheral nerves are anything that's kind of outside your brain and your spinal cord. Everything else is your peripheral nerves. So you've got them everywhere, right? You the face, arms, hands, trunk, legs, feet. They're all over the place. So but peripheral neuropathy refers to any condition that affects your nerves. This would be any kind of disease or injury. Now, I want to talk about then a little bit more about the nerves. And so the key type of the cell that makes up the nerves are called neurons. And I am going to enlarge this picture on the next slide. So these neurons send the signals through your nervous system. And that's kind of what happens with peripheral neuropathy. It's these signals that get all messed up. So here we have the, excuse me, I have to move this thing. So here's a bigger picture of that neuron. And you can see we've got the cell, the nucleus on the left-hand side, and then this long branching arm that comes out to the right. So this is the axon, kind of where you see all those little pink places coming through. And then the yellow part kind of right here, the yellow you can kind of think of as like fat. So that's a fatty chemical compound that surrounds the axon. So how do we get then disease of your nerves? So there's two ways it happens. You can have axon degeneration. So this is where the axon starts deteriorating and starts dying off. And then unfortunately, the longer an axon is, the worse it is. So this is why we tend to have our symptoms show up first in the nerves that travel to the longest points of our body, which are down to our feet, and then up our legs. And then usually by the time it reaches your knees, your nerves are kind of the same length that start going into your arms. And axonal degeneration is the most common pattern seen with peripheral neuropathy. Then the second type of disease that happens is when you get your myelin, this kind of myelin sheath, when it starts deteriorating or it doesn't form correctly. Again, that's going to affect the way that the signals go down this axon because they're used to having that myelin sheath around them. So this is going on again with our science lesson. So these on the right here, these are the 4 types of nerves, so the 4 nerves that we talk about when we're talking about the ones that are affected for peripheral neuropathy. These you can see here, they're called the A alpha, A beta, A delta, and then the C nerve. And see how the sizes of them are different? So these here, the first 2 are larger than what these last 2 are. And these are actually called our large nerve fibers and then our small nerve fibers. And over on this graph right here, it says what these specific nerve fibers, what their function is in our body. Let me just bring up this little next one here. So these A alpha nerve fibers, they carry information. Again, we're talking about signals going through that axon. They carry information related kind of to your muscle sense. The A beta nerve fibers, they carry information related to touch. So it says over here, touch. So then it would be like the pressure of the touch and vibration of the touch. The A delta nerves, they carry information relating to pain, light touch, temperature sensation. And some of the things that have to do with temperature, a lot of times hot or cold, we don't feel that correctly. Also with some of the touch that was on the earlier, sometimes you can touch, just very gently touch, and it'll seem like, you're just like being hit. Because this is what's happening with the way that those nerves are not sending the correct signal. And this last one, the C fiber, it also carries information relating to pain, temperature, and it has the additional one of itch. So when we're talking a lot about large nerve fibers and small nerve fibers, this is kind of where that distinction is. And you'll see that on these large nerve fibers too, they have that coating around them. That is the myelin sheath. And then you've got the axon inside. And it's the same one, this alpha A delta nerve fiber also has that myelin sheath about it, but it's smaller. And the C nerve fibers, it doesn't have a myelin sheath around it at all. So then these two are the small nerve fibers. Okay, all the different kinds of ways that you can get peripheral neuropathy. First, type 2 diabetes, most common cause of peripheral neuropathy. When your blood sugar is too high for too long, it does start to damage those peripheral nerves. And it says here, this is why people with type 2 diabetes can lose feeling in their feet and lower legs. And that's what happens for a lot of us where we start getting our first symptoms of peripheral neuropathy. Alcohol use disorder. You can have an excessive intake of alcohol, or when you've been drinking alcohol for a long time, that can also damage your nerves. When you have deficiencies of vitamins or nutrients, those can also do it. When you have autoimmune or inflammatory conditions, we've got GBS and CIDP. These can cause severe weakness, but they're also treatable. I'll talk about that a little bit more. And I have other autoimmune inflammatory conditions, such as what happens when you have lupus, rheumatoid arthritis, the Sjogren's syndrome, fasciculitis, and when you take certain medications and have certain toxins. And this is where chemotherapy comes in, and also certain other medications, certain antibiotics, they can also cause peripheral neuropathy. Also, if you've been exposed to heavy metals in your job or your environment, that can also cause peripheral neuropathy. Some tumors, some cancerous tumors and non-cancerous tumors can also disrupt your peripheral nerve system and damage your nerves. Genetic conditions. These examples of these are like amyloidosis, Fabry disease, Charcot-Marie-Tooth disease. There are some treatments for a couple of these, but the Charcot-Marie-Tooth disease does not have any treatments for it. Infections, you can get nerve damage because of certain viruses such as HIV or certain bacteria, such as the one that causes Lyme disease. Also, another common example is if you have or had shingles, a lot of times that can lead to lingering nerve disease. Leprosy, although it's rare, it can also cause peripheral neuropathy. And a lot of those, we're all talking about really diseases, but you can also get injuries to your nerve, which can cause peripheral neuropathy. A lot of these can happen from trauma, such as an accident, or it could happen from the after effects of a medical procedure. And then the vascular disorders, talking about the blood flow that can also, the loss of your blood flow or lack of your blood flow can also cause peripheral neuropathy. And, you know, a really good example of this is when you cross your legs and all of a sudden your leg starts going to sleep. You know, it's because you're kind of cutting off that blood flow. And what is the last one? Oh yeah, this one's not really a cause, but it's really, and this really definition is not correct, where it says it's common for peripheral neuropathy to happen for unknown reasons. It's just that we don't know what that reason is. But you will find that most of us, probably 50% of us, are going to have idiopathic peripheral neuropathy. Okay, so types of peripheral neuropathy. So you've got the three types of nerves. So you've got sensory, autonomic, and motor nerves. So sensory neuropathy is when you have damage to the nerves that tell you how things feel. Autonomic, damage to nerves that carry information to your organs and your glands. Motor neuropathy is what affects our nerves that control movement. And it doesn't just have to be one of these types of nerves that are diseased. It can be a combination of them. So just a little bit more information about those. So for sensory neuropathy, the ones that tell us how you feel. So that would be, again, like touch, the temperature, hot or cold, and then the pain that you would have a constant aching pain. And as we said before, this mostly or initially is going to affect the parts of your body that are furthest away from your spinal cord. So your feet and your legs, hands and your arms, but it can still move up into your torso and other places. So this is where we've got most of our symptoms are really going to be happening, or most of the people are going to be experiencing symptoms from your sensory neuropathy. So you've got that kind of tingling, pins and needle effect. Crawling just feels like you've got insects or something on the bottom of your feet or in your hands. Numbness to where you can't feel anything. Those shooting pains that just kind of happen, erratically. The stabbing pains when you feel like somebody's taking an ice pick or a screwdriver and just stabbing into your feet or your hands. The electric shocks. For me, this happens kind of on my shins. And I just visualize it as this lightning bolt going up my shins. And then just this constant pain that we have. So I really think that this one, kind of deserves a little bit more emphasis because this is what most of us have. Also for sensory neuropathy, you can get that burning pain kind of in the bottom of your feet. This is also really typical. I know when I get that, I end up sticking my feet out from under the covers at night, or I start putting on lotion that will hopefully bring me some relief. Also, you can have a loss of ability to feel pain, or just feel pain when you get that light touch and it feels really intense. Loss of ability to feel those changes in temperatures. A lot of people complain about their legs are really, really cold. And these are people in Arizona or, in the really warm climates. And they're putting layers of blankets on there, trying to warm up their legs. And then loss of coordination. So you can't really feel where your body is. So then that really makes it hard to balance and to move. So that's sensory neuropathy. Next one, autonomic neuropathy. So again, these are the ones that are going to carry information to your organs and to your glands. So it controls things that we don't even think about, like your stomach emptying, how your heart beats, and how your sexual organs work. So some examples of this are gastroparesis, when food can't move through your digestive system efficiently. Could have loss of bladder control, irregular heartbeats, problems with sweating. And this is kind of a common thing to have, to where either you don't sweat enough or you sweat too much. And impotence relating from not having your sexual organs work correctly. And the third one are motor neuropathy. So these are going to be the nerves that control our movement. And some of the things that this can lead to is our weakness and wasting of the muscles that don't receive those messages correctly. And this can then cause us to fall down, or just having problems like using our fingers to fasten buttons. Heard of people, having trouble holding something, trying to use a pen to write with. And it can also lead to muscle twitching and cramps. Okay, so cures, and everybody wants the cures. But in general, what we say is if you know what the problem is, try to fix your problem. So if you've got diabetes or pre-diabetes, control your sugar. If you think it's from alcohol, reduce your drinking, stop your drinking. If you have some vitamin deficiencies or supplemental deficiencies, correct that. Environmental problems, toxins, move away from that particular area. But the one thing to remember too is that even though you stop that, a lot of the damage has already happened. So hopefully you're going to, by stopping, you will, kind of reduce the progression of it. And then was talking earlier about that there's a couple of them that you can treat with, and that would be the chronic inflammatory demyelinating polyneuropathy and GBS. And you can treat those with IVIG, which is intravenous immunoglobulin. And we have several people in our groups that have that disease and are treated with that, and it does help them a lot. So then other things that you can do to help, or other things that we do to help ourselves is, we can we can manage the symptoms that we have. And we can do that with like using lotions, using nutritional supplements like alpha lipoic acid, using devices like red light therapy, or some of these small electrical devices that do help some people with their neuropathy. Can use acupuncture. So what this is going to do is manage the symptoms of the peripheral neuropathy. For some people, that's really not going to be enough, and they have so much pain that they need something more for themselves. And that's when they would go and get prescriptions for these anticonvulsants, and that's where we got gabapentin and Lyrica. Some antidepressants work very well for helping with the pain. It's taken at a lower dose than what you would use those antidepressants for your mental health. The lower dose of those does help with the physical pain. Also, the combination of those together for some people has proven more effective to be just taking either one of them by themselves. And the SCS is the spinal cord stimulator. So they're actually implanting a device in your spine, attaching leads that are going to send out signals that are going to disrupt those incorrect signals that your body is sending, so that it stops those incorrect signals from going someplace and hopefully stops your pain. The other thing that we promote a lot then is lifestyle changes. And so this talks about diet, nutrition. A lot of people have found success with having vegan diets, or cutting out dairy, or cutting out gluten, and that's helped them a lot. Exercise is by far the best thing that we can do to help with our neuropathy. And I see that with so many other things besides peripheral neuropathy. So many diseases out there benefit from us exercising. And you think about it, we're going to exercise, we're going to get our heart rate going up, your blood flow is going to start going all through your body. It's going to be delivering all that new blood, more oxygen to your cells, to your nerves. And that's what helps. Mindfulness also, since a lot of this, it's not really in our mind, but our mind can help us deal with the pain. And then the last thing I have here is our support groups. And, the support groups help us share all this information. When somebody finds one lotion that works for them at night with their burning pain and goes to the group and shares it with somebody else, this is how we all help each other. It may not necessarily work for somebody else, but at least you have something else to try. There's so many things that we see out there when you go to the drugstore. You see things when you're looking at the internet, and it always helps to know if it's worked for somebody else. So in this little blue box here, I mean, this is really what it all comes down to, is that we are all an experiment of one. You just have to try and see if it works for ourselves. And so that's why, I mean, I've done this a lot. Lots of people do this. We just have to try and see if this particular lotion or antidepressant is going to work on our body. So we talk about this as an invisible disability. When you tell somebody that you have peripheral neuropathy, they're going to look at you and go, well, I don't see anything. You look fine. Why are you sick? Or why do you say that you're in pain? And also because peripheral neuropathy is not very common. There is very little understanding of our condition, to where people would question us and go, are you sure this is what you have? You don't have something else? And again, you look fine. Then something else that happens a lot that sufferers of peripheral neuropathy get is this positive toxicity. Oh, it could be so much worse. You could have cancer, or you could, have something awful, so you should just be happy that it's only this bad. And these are terrible things. We don't want to hear this. And so that's why this little saying over the side where it says, living with chronic pain is hard, but dealing with those who don't care or understand is harder. So this is one of the things that at the Western Neuropathy Association, what we're trying to do is help educate others about peripheral neuropathy. We've created little cards that have all this information about peripheral neuropathy that you can give to family and friends or caregiver so that you can help other people understand what's going on with you. So this next thing I have, it's a really nice little story about this woman who had chemotherapy and then had peripheral neuropathy. And I'm just going to read that to you. One of the causes for peripheral neuropathy, chemotherapy. The harsh chemicals that are used to kill cancer cells, unfortunately, wreak a whole lot of other damage on the body along the way. Nerves, especially those that are far away from the brain, are some of the first to take the blows. Certain chemotherapy drugs impact those nerves worse than others, which is why everyone experiences such a variety of symptoms and severity. So it's no surprise that a staggering 30 to 40% of cancer patients treated with chemotherapy result in peripheral neuropathy. For some, it's intense during treatment. Others experience it for a short period after chemo and they begin to improve. But for some people, like the author of this, she ends up facing the reality of a lifetime of permanent nerve damage. And she says that sucks. It sucks so bad. It sucks that these life-saving drugs burn everything to shreds in their path. It sucks that hardly anyone knows what neuropathy is. It sucks that I constantly have to defend myself against handicapped parking vigilantes to justify my invisible disability. But if it's a price I have to pay for being alive, I'd take it any day. The downside is juggling this newfound disability after treatment ends. As your life returns to normal, your body often struggles to keep up. Standing all day becomes not just a challenge, but physical agony. Going back to work, to school, and maintaining a busy schedule comes with a variety of chronic pain. There are a ton of misconceptions and lack of information on what peripheral neuropathy is and why chemotherapy causes it. Not many people understand the extreme and debilitating pain it can cause. The author has had pain so extreme, it felt like her legs were being hit with electric shock treatments repeatedly until she felt like her bones were going to crack in half. And that's one way to explain it. And that's on a better day. On the worst day, the pain flip-flops between numbness that gives her the balance of a drunk as she loses all feeling in her legs and feet. And to add insult to injury, the nerve damage can be so great that it impacts the type of shoes you wear. Goodbye heels, tall boots, and most shoes that press tightly on my legs or sides of my feet. As a woman that owns over 30 pairs of shoes, it's devastating to have my selection narrowed down so drastically. These are small things to some, but to me, it's just another aspect of how my identity, cancer, has taken from me. As something that impacts so many of us cancer patients and survivors, there needs to be more information on this, more compassion, more empathy. The treatment doesn't end when cancer ends, so it's a shame that for so many, their support system ends. Now, I have to say that for our support groups, we do have several people that have their peripheral neuropathy from chemotherapy. And so we're really glad that they've found our group so that they have another avenue of support for them. So now I just want to talk a little bit, what's my time? Okay, about the 5 stages of grief that come with a medical diagnosis. And this is definitely written after the same line as the Kubler-Ross 5 stages of grief. But it's just from the perspective of a patient's relationship to their body. And, I just really identify with this first sentence here, how grieving your health after a new medical diagnosis can be an unexpected challenge. I did not expect that at all. And that this cycle can keep on repeating yourself as all of a sudden some new symptom happens and you find yourself going back to the beginning. So the first stage of grief, maybe, just a minute. There we go, is denial. This is where you're kind of rejecting reality. But you may ask, well, why denial? I mean, shouldn't the patient be glad to finally have an answer? But even though you've got an answer, that doesn't mean you know how to cure it. And the other thing you may be thinking of is, well, maybe I really don't have this disease. I mean, we're all still in denial. Second, anger. When you find this out, you get angry at yourself, angry at your doctors, angry at the world. And, you may say, well, why didn't the doctor listen to me earlier? I told him what all my symptoms were. I told him I was in pain. Why didn't he know then what it was? Or you can get mad at yourself. Why didn't I go to the doctor earlier? And we all know that you can get mad at your doctor too for not really helping you enough. 3 is going to be depression. And this is really a good one because, it's a good one that all of a sudden you find out this stuff really isn't all in your head. I mean, these are true symptoms. Your symptoms are valid. Pointless to sort you out. But it also, you get so upset because you're looking for your treatments. You find out there's not anything there and you just want this disease to go away. And so then you kind of get in the bargaining negotiation part. What if I had done something different? What if I hadn't drunk so much? If I hadn't taken that type of medication? If I had changed my diet? We're just not really thinking correctly here because all that stuff is already happening. You can't change any of that thing in the past. And finally, hopefully you come to acceptance. And you accept that you have this disease called peripheral neuropathy. You accept that the pain's there. And you accept that this is like your new normal. But that doesn't mean that by any means you are happy about this, or you're content about it. It's terrifying. It's terrifying to try to find something that is going to help you. and you're worried so much about the future. We all go through that. But just to know that there's other people out there that can help, I think helps a lot. So with this acceptance, also to remember that those of us with peripheral neuropathy, we need to have a little self-forgiveness here, and we need to show ourselves a little kindness. So emotional pain and support. So, living with nerve pain is not easy. And I have to say that I really don't have that with my peripheral neuropathy. And I hear so many people that do. And I tell you, it does it does not easy. It doesn't sound easy, especially for those people that have had this pain for a long time. You can get very hopeless. You can get very sad, angry about this, that you can't find anything to help with this pain. And so, because of that, a lot of times people are going to start withdrawing into themselves, and they're going to start, they're going to start doing the things that they used to do. I hear this a lot, I'm not able to do something anymore. And I don't want to talk. I don't want to be with my friends or family because they don't understand what I'm going through. They're telling me, oh, come on, walk faster, keep up with us. So it's really important, though, for the patients to talk about how they're feeling. And it's important for family, friends, and caregivers to listen to us patients. Sometimes we just want to talk about it. We just want to vent, and we just want you to listen. We know you can't necessarily, find the treatments or help solve our problems. But what we need is your understanding, your encouragement, and your support. Okay, so from that, we're going to talk about support. I am going to shift a little bit to the caregiving section. And I am joined with by my husband here, wherever he is. Wave your hands, Jeff, so I can find you. I don't see him.
Second page in the middle.
I'm right here.
Oh, there he is. Thank you, sweetheart. Okay. Okay. Yes, Bill, I see you're pointing down. Okay. Yes, I see. He's over here on my page. Okay. So first, I just want to tell you a little bit about my neuropathy. My symptoms started in 2014 with a little bitty size bump on my section on my foot where I couldn't feel anything. It progressed on my feet in 2016. I went and had lots of tests done, and the doctor said I had idiopathic progressive polyneuropathy. So again, I have very mild symptoms, but I do have symptoms, and I do have the emotional stress that has gone through finding out this diagnosis. So, Jeff,
Yes.
would you would you like to talk a little bit about how you have supported me with my neuropathy?
I'd love to. Thank you. Okay, first of all, everybody, I tend to get off track every once in a while, and I tell stories. So Catherine will jump in periodically to get me back on track. So, okay.
Yes.
That's so that everyone can expect that.
Mm.
In the beginning, I kind of thought, yeah, it's nothing. Yeah, you got a little numb spot. You got this little tingle. You got your feet are hot, yada yada. Everybody has aches and pains. What's the big deal? Kind of harden up, and but then over time, Catherine was going to doctors, one in particular, and she was getting some arduous tests done. I have to look at my notes here. She got a core taken out of her foot, and she doesn't like pain. So, that's a pretty big deal. So it's pretty
Also,
important to her. And
also I had that
nerve conduction test.
that nerve conduction test. Jeff was not there for that when I was crying. I kind of told him after that he had to be with me with all my future tests.
And I said, okay, so this is getting kind of serious. If she's going through this kind of angst to try and figure stuff out, obviously it's pretty important to her. And so it kind of moved up my priority list to where, I understood that and accepted it, rather than just kind of blowing it off, I guess, which is kind of telling, not in a good way, of the way that I was taking what she was telling me. So then Catherine started really trying to get educated and learn about the disease and learn about the symptoms. And it obviously was quite important to her. And so by default, I started learning about the disease too, because we talk a lot. She says, "Ooh, look what I found." Or she says, "This doesn't make sense." Because many years ago, when I was a young lad, I was interested in being a doctor. And so I did a lot of stuff to kind of put me on that path. I ended up being an engineer, but anyway. Um, she, so she could ask me some things about basic body function or stuff, and I could kind of point her in a direction that would help us both understand what these papers were talking about. So we ended up, we know a bit about this, I guess is the best way to put it. So then we started looking at, remedies, because we're going to fix this, no matter what it takes, we're going to fix this. And so there's lots of things out there. And a lot of them, in my opinion, fall in the snake oil category. And, you know, each person has to kind of weigh the financial cost of something versus the potential gain. And some things are quite cheap. Some things are less so. We attended a luncheon with a guy promising to get world peace almost. And so obviously we didn't do that. But other things, she'd say, "Oh, look at this. I want to try this." And I'm thinking, man, there's no way that's going to work.
But
But
it did,
well,
right?
some did, some didn't.
So the
Yeah,
nanobubbles, I don't
yeah.
know if the new people knew about this, but 2 years ago, there's a doctor in Austin who created some nanotechnology. And I tell you, I've used that stuff for 2 years, and it's helped my neuropathy a lot. And I didn't know till that Jeff and I were talking about this, that when I first started it, Jeff thought it wasn't going to work. He thought it was snake oil. But he never said anything to me about that. He just kept on encouraging me. And, looking back, I thought that was really cool, because if I'd have known that he thought it was snake oil, then I may have not done it. So by him encouraging me instead of telling me his opinion, it enabled
Which
me
is
to
a
get relief.
rarity, because I do
Yes.
tell you my opinion.
Yeah, right. But it really changed my neuropathy too. I mean, my neuropathy, I used to have stuff all over my body. And when I started using those nanobubbles, all that body neuropathy numbness went away, and to where I only have it in my feet now. So for me, it worked.
Yeah, and that's where you're making those computations in your head. Is this worth telling Catherine it's a stupid idea for the X amount of dollars for it, or is it just okay to let her do it? And so that's part of the support, I guess, of the caregiver is it's her disease, it's her body. She can decide, and she sounds stuff off of me because we're a team. But I mean, that's it. Just some work, some don't. You have to try it to find out if it's going to work. You can't just look at something and say, and we'll get to this in a little bit, but writing the story before it happens. You can't decide without trying something whether it'll work or
We
Okay.
did, yeah, we did try those patches that kind of, are supposed to put some electromagnet something energy into you. I mean, I looked at it and, I've got a physics degree. I thought, this could work. Well, it didn't do anything. I was wearing these patches and these, so
It didn't do anything for you.
that's
And
right.
it that's something I hold up every once in a while. You remember that snake oil you tried? That didn't work.
Yeah, that did.
But you never know. So that's okay. Some stuff works, some doesn't. Everyone's an experiment of one. So say, oh, I'm we have found things together that work for Catherine for her particular discomfort symptoms. Feel free to correct me on my terminology. Um, and one of them is if she wears the same pair of shoes all day long, no matter what shoe it is, her feet will really give her trouble at night or for sure the next day. And so sometimes she gets distracted and, I'll periodically ask her, hey, have you changed your shoes today? And she'll hop up and go get a different pair of shoes.
Makes
Or she'll say, yes, I did 2 minutes ago.
makes me feel like a child. Have you changed your shoes today? And oh yeah, yeah. Because I
Yeah,
do forget that a
and
lot. Yeah.
so the lesson for that for me is I need to pay attention to what she's doing. I need to pay attention to what we have noticed worked in the past and kind of put those together to help continue that trend of whatever it is to where it works. And when it stops working, well, we're going to go find something else.
Yeah.
So, there's not a lot of those things. There's a couple of things. We're in the middle of an experiment at the moment. I'm doing a sidetrack. Um, Catherine's feet get really, really cold sometimes,
Yes, I do.
and she has a pair of shoes that absolutely work. She puts those shoes on, and boom, her feet are warm. Um, they're large, and we're going to go on a trip, and we don't really want to have to carry them with us. So we're doing an experiment to find another pair of shoes that'll do the same thing.
That are smaller, that
That
are
are
dual
smaller.
action. So
Yeah, that she was going to take anyway. So it's just kind of working with her to not take care of, but work on the symptoms.
so
Um,
yeah,
so
Jeff's been just, really positive. I mean, I've really been I was really surprised to hear that he didn't believe all the snake oil ones. But he kept his mouth shut. And so that
yeah,
that was very encouraging for me. Yes.
yeah,
Thank you.
and yeah. Um, Another thing that works for us is, and kind of alluded to it earlier, is I'm a sounding board. Catherine has an idea. Catherine reads something on the internet. She discovers a paper, a medical paper, what have you. And, you know, she brings it up and we talk about it. And so that seems to, that helps her mental well-being because it gives her confidence and keeps her from sliding into depression that she's not getting anywhere, there's nothing happening, and all that, which brings us back to writing the story before it happens.
Right.
And I don't know if she's talked to y'all about this in the past, but if you're presented with a situation and it's kind of not to your liking, and you project into the future that X is going to happen and X is really, really bad. That's writing the future before it happens.
Story.
Yeah, the story. Yeah, the story. And there's so many things you can do to change that outcome. Sometimes you can't, sometimes you can. You never know. Give it a go. And so, you know, a lot of it that we've kind of discovered is attitude. That if you think gloom and doom, it's going to not be all that great because you're not going to put much effort into it. If you think positive thoughts, hey, we're going to try this, see what happens, and this, that, and the other thing. There's
All
a
right,
lot of
all right.
it.
No, nothing about thinking positive thoughts. We're not going to do positive toxicity.
Oh no, that's not what I mean. You know, that your plan, yeah, that's absolutely fair. Yes.
Yeah.
But yeah, you know, just don't focus on the absolute worst outcome and let's go forward.
One of the things that really worked out well when we're talking about don't write the story before it happens was right back in the beginning of my diagnosis when I found out what I had, was doing my initial research and just went off the deep end. And I was really scared. And that was the one thing that worked for me, was Jeff reminded me of that phrase, and it kind of settled me down. So, I think that's very cute. Miss Carpenter asking if he cooks and cleans. He cleans dishes. He does all the dishes. So
yeah, you don't want my cooking.
You don't want his cooking.
Nope.
So does anybody have any?
Wait a minute. I've got more.
Okay, but maybe
we only got 5 minutes. So let's go to questions.
We have 5 minutes and we have to let people ask questions.
No, just go to the questions. If there are any. If there's no questions, then I'll talk some more.
Okay. All right. Okay. Does anybody have any questions after we're doing all that? And we can just,
I have kind of a question or a comment, if I may.
Yes, please.
Well, first of all, thank you, Catherine, and your very sensitive husband for sharing your stories. That's beautiful.
Absolutely.
As you talk about people who are suffering from peripheral neuropathy, to the experiment of one to try different things, I have a concern that not all of these snake oil, potentially snake oil treatments are necessarily going to be benign. Some could actually be dangerous or do harm.
Oh yeah.
So that's one sort of concern that I have. I don't know if there's an answer to that. People just have to use common sense, I guess. But related to that, are there other, who's doing the clinical studies or the actual research on treatments for peripheral neuropathy, if there are any such studies going on at all? And are there any agencies that are interested in funding research into causes and cures treatments for peripheral neuropathy? Thank you.
So Yeah, so we have NIH, National Institute of Health, is kind of keeps track of all the clinical trials that are going on. There are now about 10 drugs in the pipeline that are at least in phase 2 clinical trials that have to do with pain for peripheral neuropathy, and that's mostly what the research is on. Is people are looking for medicines to help with neuropathic pain. So they are going on. I keep track of those. Also, the Department of Defense, this is year 3, I think, has given out grants, given out money for research on peripheral neuropathy. I wrote about that in the newsletter maybe 2 months ago or so. Peggy, you've got your, where'd Peggy go? You've got the Neuropathy Hope. You've got the Neuropathy Hope newsletter. It's in there somewhere.
Yeah.
I wrote an article all about the top grants that were given out, and I wrote about the additional medications that I found that were also being researched. So there is not as much as for other things, but it was a really good achievement that finally the Department of Defense 3 years ago started funding for peripheral neuropathy research.
If I can jump in for just half a sec. As far as a snake oil thing that comes up, do research on it on the internet. If you can only find stuff from the people who are doing it, well, that's a pretty good indication that it might not be all that great. Or people that are kind of paid to sponsor it, sort of thing. Like you said, Paul, it's common sense, but it's hard to have common sense about something that you don't know anything about.
Well, also, we're so desperate to find something. I mean, I hear this a lot. We're desperate to find, and these people put on a good presentation, and they have lots of good testimonials in there. But it's really a good tip off when it's going to cost you $10,000 to $15,000. It's not covered by insurance. Yeah. So do your own research. Yeah.
It depends how desperate you are and what the cost is to you and all that. Nobody can make that decision except you. That's all I got.
And in regards to funding too, WNA does actually, we're supporting a grant, or we've done grants to someone who's working on a drug. There are quite a few different neuropathy organizations that are supporting research. Looking through any of those, really, you'll be able to find. I know the Foundation for Peripheral Neuropathy does some of that. We do some of that. If in terms of finding ways to figure out if something's snake oil or not, just to bounce off what Jeffrey's saying, come to a group. Come ask us, between Glenn's medical expertise, all of us who have been here, trying 20, 30 trillion different treatments to hope that something will work. Someone's probably tried it or heard of it or got some research on it or can look into it and be a sounding board, just as, Jeffrey is for Catherine. We kind of do that for each other as a group.
Yes. Yeah, we do. I've had people write me and say, I hear about this. What do you think? So I have done a lot of research for people to, find out about those also. Did that help, Paul, with your questions?
Yes, very much. And thank you, Shana, for reminding us that you can really benefit from the experience of others, for sure.
Exactly. And that's why, we've got our support groups and we've been really successful with them. Is everybody sharing all their information really, really helps. And two, just finding out that you're not alone. I remember how Shauna reacted when she finally found us, and people that are suffering from the same things that she is. I mean, a lot of people say that I just thought I was all by myself trying to navigate through this. But so we're always very welcoming for new people to come. Any other questions? Yes, Peggy.
Yeah, my family will keep you going for questions. This is a technical question. In the
Yes,
beginning,
ma'am.
you had that diagram of the the four different nerves,
Yeah.
A, B, C, D, whatever they were.
Yes.
And the A beta was in
Yeah.
charge of touch. And that's one of the larger ones. And it's a given that I have small fiber neuropathy, but I have bizarre touch where you touch one spot in my leg and the whole thing reverberates. Does that mean I have large fiber too, or is it
No,
across
I
this
think
stuff?
it was also on one of the smalls that talked about touch too.
Okay.
Let me see. This is going to be like making me really question my technical ability if I can't figure this out.
Well,
All right. So it's
doesn't,
this picture, right?
yeah.
Let me see if I can enlarge that.
I don't want
Whoops.
you to get bogged down though. I mean, I've got what I've got, so
Yeah. Well, because I mean, and it does seem like there's overlap on some of those nerves.
right.
Sorry. All right. So see, because yeah, but I think also, let's see if I can go back on this one. Yeah, the A beta and touch is also here on this A delta. See where it says sharp pain, very light touch? And that
Okay.
A delta is a small fiber.
Okay. Big or
Okay.
small, I've got it, so it doesn't matter. But
Yeah.
could I get to my real question?
Oh,
What are these magical mystery nano bubbles you're talking about?
no, probably need. All right. Actually, you go to our YouTube channel. There's a webinar on there. The doctor gave a webinar to the group a couple of years ago. So go to our YouTube channel and see about that. He created this gel that enables you to put more oxygen into your feet. And again, just like with exercise, more oxygen, blood circulates better. You get oxygen into your cells. For me, it worked. A lot of people, it didn't work. We had our own group session clinical trial going on. It was mostly me. So,
Okay, thank you.
yeah. Mm-hmm. Any other questions? Just because I did a really good job giving my scientific presentation, you don't have any
I
questions.
think I saw Lolene raising her hand.
Lolene, where are you? No. Okay, there you are.
She's right
You have a
there.
question? Yes, ma'am. Where is she? Did you? All right, she's down. Yes, thank you. I saw her. She waved her hand, and then all right, Lolene. So, all right, can you talk, or did you have a question, or you don't, have a question? No, because if you're talking, I can't hear you. I mean, and it's not that you're muted. It's just I don't know. You've got your new laptop again. That's put it in chat. Put it in chat if we can't hear you. All right, Nancy, you got a question?
Yeah, can you hear me?
Yes, ma'am, I can.
I want to know any cure for balance.
No cures for balance. No, it's just going to be, symptom management. Really, the best thing for balance is exercise. Lots of exercise.
I can't walk.
Yeah, it doesn't have to be walking. It doesn't have to be walking.
I do sit and stands. I ride my bike.
Yes.
Bike.
Yes. Right. So, there's other things that you can do just in your chair for chair exercises that will also get your blood flowing. I mean, that's the main thing. Get your blood flowing. And yeah, you can do your sit and stands, but you can also try your sit and stands without holding. So I know you hold on to your walker sometimes when you do that. Try to stand up without doing that.
I have no balance.
See, so you can just do a little bit. I know you have to tighten all those core muscles to help you do that too. But you can also do chair exercises by going to the website. What is it? The lady that has her chair exercises. I can't remember what it is. I've sent you the information once, I think. Who knows what that is? It's on the PBS channels. Somebody help me. I don't remember. But there's like chair yoga. There's all kinds of chair stuff.
Somebody, yeah, Chappie. Somebody,
Yeah,
Nancy.
yeah.
Chappie,
And what's the name of her series?
Sit and be fit. Sit and be fit.
Sit and be fit. Yay, Diana. Sit and be fit. So that is on the PBS stations. She also has a website, and she has free videos on the website, and you can also pay her money, and you can get additional DVDs or additional YouTube access. Sit and be fit. So you just have to exercise more. No magic pill. Yeah.
Thank you.
Okay. Okay. Any other questions before we wrap this up? Nothing else? Well, I want to say thank you then to my husband for, exposing himself to being my caregiver. Yes, thank you. Well, I'm going to clap.
I did not expose myself. Wait a minute.
Well, you're sitting down.
Yeah, you get put in jail for that. Now, come on.
And thank you to everybody for coming and listening to our talk. I think, as Shauna said, that the video will be posted on our YouTube channel, which you can get to by going to our website at www.pnhelp.org. Daryl, is there anything else you want to say for us?
No, other than I think it went very well. I appreciate everyone attending, and you did an excellent job.
Yes, she did.
Thank you both.
Thank you. Thank you. Thank you. Thank you. Thank you, everybody.
Yay!
Thank you. Thank you. Okay, then we'll see most of y'all in support groups. Those of you that don't attend our support groups, please come. We would love to have you. You can always get information on our website or send an email to anybody, and we will help you with that. We would love to have everybody show up to where we can share more information and hopefully help you with this awful disease. Okay. All right. I am going to leave. When I leave, you're still going to be on. So I think it's only Lindsay that can have everybody go. So everybody, goodbye.
Thank you so much.
And we'll see y'all next time.
Yeah.
Bye, everybody.
Do come to the next support meeting, which is September 9th. I have it in the chat. It's 2 p.m. Eastern Time, 1 p.m. Central, 12 Mountain, and 11 a.m. Pacific.
There you go. Okay. Yep, that's it.
All right,
Thank you,
everybody.
Catherine.
All right. Thanks, Lindsay.
Hey, see ya.
Bye.